Kia ora koutou and welcome to this presentation for Year 3 Physiotherapy Clinical Supervision for AUT students. I'm Sarah Bonham-Lloyd and I am the Program Lead for Clinical at AUT. This is the first of two presentations relating to the Year 3 programs. This first presentation is an overview of the program and Year 3 clinical supervision. The second presentation is about the assessment and marking of the clinical assistantship. To briefly overview the AUT Physiotherapy Clinical team, there is myself, Sarah Bonham-Lloyd, as the clinical lead, and I work very closely with Catherine Ferguson, our clinical coordinator, and we also have Shirley Talon, who is our physiotherapy clinical administrator, and she sits behind the physioclinical at aut.ac.nz email address. So this slide is just a short overview of the many roles of a clinical centre leader. Their role ranges from arranging and allocating students to specific clinical placements, to being a support person, not only for students, but for you as clinical supervisors. So the CCL is your first contact person for support with assessment of students, moderation of grades, and problem solving when required. The image I'm showing here is a communication flow we show to students for their use during a clinical placement. The CCL would have already had a role with students with their induction and allocation to you as a clinical supervisor, but during a clinical placement, as a clinical supervisor, you will be the student's first point of contact and will provide the local and day-to-day support and assessment, and the CCL is the student's second or next point of contact, but your primary contact person. Then students and CCL will liaise with us at AUT to the clinical team when required. To provide you with a very quick overview of the AUT physiotherapy program, AUT currently has two pathways on the Bachelor of Health Science and Physiotherapy program. So we have a standard and honours pathway. Students complete the same courses across year 1 and 2, and students who have applied for the honours program will undertake some slightly different courses in the second part of year 3 and also a research project in year 4. However, the clinical components of what they do are all the same across the 4 years. So year 1 and 2 currently has observational opportunities in the community and also with patients in our AUT Health Centre. In year 3, students have also had other labs in the health centre and in class, and this has included adult populations, paediatric populations, and also an acute care simulated patient actor session. So in semester 2, they progress on to this 2-week clinical assistantship, which is where you will meet the AUT students. And the next slide just outlines what some of the aims of that clinical assistantship are. This enables the students to progress into year 4, where currently AUT students complete 3 8-week blocks of clinical placements, which is assessed on the APP form we call, or the Assessment of Physiotherapy Practice. The clinical assistantship, as I said, is the focus of this presentation, is a 2-week, so approximately 80 hours of clinical experience. It's currently attached to a course called Managing Complexity in the Acute Care Environment. However, we recognise that not all students can be placed in acute care for this assistantship. So it can be in any clinical environment in any area of practice. The aims overall of this clinical assistantship are to facilitate students' transition towards the year 4 clinical year, to provide students with socialisation into the physiotherapy profession, along with learning opportunities actually in the clinical environment. And where it's called an assistantship and has been called this for a number of years at AUT because it's not just an observational placement. It is about observing, but it's also about assisting and participating with you in physiotherapy practice. Around 1 to 2 weeks prior to the start date of the clinical assistantship, you should receive an email from the student or students who are being placed with you. So we call this an introductory email, and we've asked the students just to send you a little bit of information about themselves, perhaps their background, their area of interest, and whether they do require any other considerations from you during their placement. Your clinical centre leaders would have also already emailed you with the names of the students, so you'll know who you'll be expecting that introductory email from. And if there are students who require additional support during the clinical assistantship, your clinical centre leader would have already told you about this as well. So we ask you to please reply to the student's email. The important information to set out within that email is just where to meet you on day one, or if they're having an orientation with the CCL on the first day, it may be that they're meeting you in the afternoon or even on day two. But how to get hold of you, any important phone numbers or contact information, just in case the student were to be running late or unfortunately sick on any day. If you have any other information too about the clinical environment, the practice area where you work, we also ask you to send that to the students as well, as that may outline some specific areas of preparation that you might expect from the students before they arrive. We also ask you to reread the learning outcome and the marking criteria associated to the clinical assistantship. A couple of other things to think about in your preparation in those couple of weeks prior to the placement is creating some plans. So especially having a timetable or a plan for day one, we think is really important. You can even send the timetable to the student as part of your reply email. And that just helps to give the student an understanding of what your working week looks like. Within day one, we also ask you to have an orientation plan just to show the student or students around your clinical area, introduce them to people who they might also work with or important people they might need to know during their clinical assistantship, and just the spaces within which they can work as well. We will ask you to consider your expectations and talk to the students about your expectations, and I'll outline those on the next slide. The other thing we also ask is that you have informed the others, the team that you work with in your clinical environment, that you are expecting a student in the next few weeks. So just coming back to thinking about those first few days of the clinical assistantship. It's a good idea to think about what your expectations are prior to the placement and set those expectations on day one. So remember, expectations can be implicit or explicit, and we really do ask you to think about being explicit around your expectations, as this is the first time that students may have been in your particular clinical environment. And setting expectations helps to make it a little bit smoother. So one of the expectations we think is important for you to talk about is, what is professionalism to you and what does that mean in this setting? Also, what are some of the requirements of the learning outcomes and what might this mean or what might this look like within your clinical setting? And we'll talk about these a little bit more in the second presentation when we look closer at the marking criteria. Across the 2 weeks, we ask you to provide the students with lots of different learning opportunities. So as we said, it's an assistantship, so it is observation, but it's also doing. We are asking students to assist you with subjective, objective treatment, daily physiotherapy duties, maybe even with fourth year students if you do have some fourth years on placement at the same time. Students can also participate in team in-service meetings. We do ask you to provide experiences with other team members, other health professionals if you work in a multi-professional environment. We ask that students read patient case notes to start to look at analysing medical information and relevant data, and also provide students with opportunities to write notes in whatever format you utilise in your environment. We ask that the students get an opportunity to just understand how you obtain informed consent with patients, and also have discussions with you about other ethical and professional obligations. We do ask that students, as I say, have an opportunity to do and be physiotherapists. Conducting subjective assessments is a really easy way for students to start to ease into that clinical and professional environment. We do provide you with a 2-week quick guide as well. That is an easy quick reference for some of the things we ask you to be able to provide for the students, and a reminder of some of your tasks across. This slide overviews the documentation that is required for the Year 3 Clinical Assistantship. As already outlined in the preparatory information, students should be emailing you 1 to 2 weeks prior to the start of the assistantship with an introductory email, and we ask you to respond to the students. We also ask you to please review the assessment form or the assessment marking criteria prior to the placement starting. During the placement, the only documentation we ask you to complete is the final assessment form. We ask you to complete that on either the Thursday or Friday of week 2, and you can refer to the 2-week quick guide just as reminders around that form and what we ask you to provide the students with across the assistantship. Once you've completed the assessment form, we ask you to please email that completed form to the student as well as your CCL. It is really important that you email the form to your CCL, and the students have a requirement to upload it onto our Canvas system. Students are also asked to complete a reflection during the placement. So that is something you may ask the students to show you, and that can be a good idea to have a look at that around the end of week 1 or early in week 2, just to review if the student has any particular goals or any particular learning opportunities they are hoping to see or do during the assistantship with you. However, the only requirement is to please complete the final assessment form at the end of week 2. Just for AUT to be explicit with you, what is not expected, we are not expecting students to develop or implement treatment plans independently, so that means not without your guidance. So we are expecting them to implement and develop some treatment plans. We're just saying we're not expecting them to be able to do that autonomously or independently on their own. So that also means we're not expecting students to be able to manage their own patient caseload within that 2-week placement. And to support your role as a supervisor, we've just given you a few tips to think about when you are planning some sessions with the students. So the idea around graded exposure is this idea on being able to scaffold or build students' learning. Things you can do is demonstrate, first of all, so students might come in and watch you, so that is that observation component. And then maybe you can progress that on to doing together. So maybe you do part of a subjective, the student does another part, then maybe you go on and do a few of the objective tests, the student does a few of the objective tests, and then that progresses on to the whole part task and letting go. So maybe the student does the whole subjective and you do the objective, or round the other way. So whilst I've focused those ideas just around assessment, the the same concepts exist for treatment with patients too. If you have any concerns about a student, whether it is professional concerns, behavioural concerns, concerns for them around their mental or physical health, or just any doubts that you have, your first port of call is your clinical centre leader. But just to make you aware that if there were any more emergency scenarios, if the students were expressing really poor mental health or concerns around self-harm, AUT does have a duty of care, so it's really important that you please do contact us at AUT. If you do have concerns about a student, or if a student does tell you something that's quite private to them, it is important that you maintain a student's privacy without compromising sort of confidentiality. So it's important to hold a conversation with the student too, and acknowledge through saying thanks, for sharing this with me, but I need to make sure we get you some appropriate support. So let them know that you're going to speak to the CCL or contact AUT. So if you recognise or you think that there's any issues with the way a student is managing their own physical or mental health, please just discuss this with your clinical centre leader. Any concerns around a student's performance or their ability to meet the learning outcome, again, please discuss this with your clinical centre leader as soon as it arises. And just as a final few reminders, students are required to attend all placements unless there are extraordinary circumstances that prevent them. So if a student is sick or something happens to them on a working day, they need to just make sure that they contact you before the working day begins if they're unable to attend. And if a student requires more than 3 days off for any reason, this clinical centre leader will need to have a conversation with AUT if the student is actually able to continue the assistantship at that time. But please ensure you do notify your clinical centre leader if a student has any day off during this clinical assistantship. So thanks very much for listening to this first presentation. A massive thank you from AUT and the AUT Year 3 students. We know they're going to have great experiences with you during their clinical assistantship, and they're really looking forward to meeting you. Ka kite, thanks again.